Her carbon footprint is 12 grams per collection smaller. She has 1/3 as many needle stick injuries. Her needles cost 1/3 as much. She is the most interesting phlebotomist in the world.
I don't often use butterflies, but when I do, I need a good reason. Patients sometimes demand that you use a butterfly. Listen to them and find out why. Getting lucky once isn't a good reason to do it again. Some patients wrongly believe the butterfly needle is smaller. As a professional, it is your responsibility to pick the right tool for the job. Make sharp choices, my friend.
In blinded studies, even with the same size needle, there is no clinical difference in pain. She is the most interesting phlebotomist in the world.
I don't often use butterfly needles, but when I do, I have a reason, like fragile or very superficial veins, as in the very young or the very old. Make sharp needle choices, my friend.
She is less likely to get injured with a combative patient. She saves about 1 second per tube. She is the most interesting phlebotomist in the world.
I don't often use butterfly needles, but when I do, it is to serve a purpose. Butterfly needles help me make sure a blood culture bottle is correctly filled. Make sharp choices, my friend.